All right, something else PT school taught you. You need to do special tests so you can come up with a diagnosis, and you need to have differential diagnosis skills because there's a difference whether somebody comes in for tendonitis versus bursitis or tendinosis versus tendonitis. So those are very different things that need very different treatment strategies. And then what you learned when you got out in your clinicals was that the treatment strategies was pick either symptom modification gimmick A, maybe cupping, or symptom modification B, needling, or symptom modification C, whatever the patient wants, because that's what they heard their friend did at physical therapy. So hopefully you figured out that A, you don't need to do special tests because special tests aren't special and they're not significant, and you should be able to figure out what's going on with your patient by the time you get through the subjective and they're describing what happened with the mechanism and they're describing what their function is. And then when you get through a functional assessment, that should make it abundantly clear, or at least put them in an area that is going to be able to tweeze out information from once you get more analytical by putting them on the table and breaking them down piece by piece. But you don't need to do special tests. You don't need to come up with a diagnosis. So why do I need to give them a fancy name for plantar fasciitis? Is that going to change what I do treatment-wise? No. Is that going to change what I do patient education-wise? No. So why am I going to spend an extra 5 to 10 minutes doing tests that don't matter to come up with a verbiage of a diagnosis that doesn't matter? And the more you go down that road, the more you go down the road of, oh, it's this diagnosis, which means we do this treatment strategy, which goes with that diagnosis because that's what somebody told us. So what we should be doing is listening to what they tell us, then watching what they can and, more importantly, what they cannot do functionally, then break that down more analytically into the muscles that should be stabilizing and moving the joint in that angle during that range of motion, which would get us to the root cause, which would get us away from tests and diagnosis and differential diagnosis, which doesn't make any sense. So remember, PT school wants you to come up with a diagnosis because that's when you go get the handout that has those specific diagnosis exercises and stretches and treatment strategies, which are all symptom-based. Nothing to do with root cause, only pain, swelling, lack of range of motion, tightness, weakness, blah, 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 blah. Doesn't matter. Sends you down the wrong road, which is why you have a toolbox jammed with ice and stem and heat and cupping and needling and tape and orthotics and massage and corrective exercises and a whole bunch of garbage that you have to fall back on because you were pushed in that direction by what you did with your special tests and your differential diagnosis. So I've said this like 5 different ways now. You don't need to do that. Assess what they can and can't do, assess their function, use your thought processes, which you should at least understand anatomy, neuromuscular physiology, biomechanics. You should at least have a grasp of that stuff after you go through 7 years of school. So you should be able to start asking the questions, what does that science have to do with what my patient just told me and what I just saw on a functional screen? How does that relate? And if you're starting to ask yourself those questions and you're coming up with the answer of, I don't know because I wasn't taught how to figure this out, you're in the spot that you need to make a decision. You're either going to make the decision to keep going down the conventional PT road and keep using broken thought processes that do nothing but shove you down a road of symptom modification, or you're going to say, okay, I'm starting to understand that I'm missing something here. How do I figure out what the missing information is to glue these things together to make this make sense and allow me to help me get real results with my patients rather than short-term symptom modification junk. So if you're at that crossroads, either go down the road of confusion and burnout and throw your career away with conventional PT, or go down this road where you can join the shift and I will teach you how to glue all those things together so it actually makes sense and you have a systematic thought process that takes you all the way from subjective all the way through patient education and exercise prescription, and you get results because you're not getting hung up on old school PT things like special tests and differential diagnosis, which do not matter no matter what they told you in PT school. So here's your chance. You're ready to get in the shift. Let's do it. Let's get going. We've got a lab weekend that's coming up. If you want to be in that lab weekend, you need to get in the shift now.